Hello everyone, I'm Dr. Dharma Khalsa, President and Medical Director of the Alzheimer's Research and Prevention Foundation. So I think everyone would agree that we are in unsettling times right now because of the coronavirus. It's a pandemic and it promises to accelerate somewhat before it gets better. Everyone is affected. We're all affected, whether we're healthy or whether we're not healthy, whether we have someone in our family with Alzheimer's disease or we're a caregiver. There's a lot of extra burden. Also, people with medical illnesses, heart disease, lung disease, are especially at risk right now. So everyone is affected. So we have to really be careful, because I see that a lot of people, of course, it's natural, it's normal, we're all very worried. There's a lot of stress going around. And the number one thing I see is that people are out of balance. So it's really important to try to do things to keep yourself back in balance, keep yourself in balance, even if you're hopefully staying at home. You know, if you're self-quarantining or staying at home, make sure that you're doing some exercise. You can even go outside as long as you're maintaining social distance and take some exercise, especially if there's some sun in your area. It'd be good to get about 15-20 minutes of sun. Make sure you use sunscreen. So we want you to exercise. That'll help you also to do home yoga, meditation. We have our Kirtan Kriya that we've been researching all these years that definitely will help you because it improves your energy, it decreases stress, it improves your immune function, and of course it improves your brain power. So we are preparing programs for you to assist you, and we'll have more about that coming up. We're going to have some nice webinars and other things to really assist you during these stressful times. So right now, ladies and gentlemen, we are on pause. We're on pause, like your computer is buffering. You know, we're on pause. And I think while we're on pause here, I would like to emphasize that it's critically important to follow the CDC guidelines, because I agree with them on everything, really. You know, have social distance. If you're going to be around people, stay 6 to 15 feet away. That's critically important. You know, they always say, wash your hands. I mean, you have to be obsessive-compulsive about washing your hands these days. Every time you go anywhere, come back, wash your hands. You know, we don't have, for example, anyone in our house with the virus, but every time we come in from the outside, we disinfect everything, we wash, and we disinfect whatever we have with us. So now I want to show you just a little bit about how I'm an anesthesiologist by training, and I want to show you how, you know, that we wash our hands in the operating room. Okay, so obviously I don't have soap and water here, but you go to the sink and you soap up, you put on get that hot water on there and you soap up, and now here's how you do it. You go this hand, start with this hand, and then you go down your thumb, up your index finger, down, and then up, and then down, up, down, and then, you know, around that left hand to the wrist. In the operating room we go up to the elbow, but we're only going to go up to the wrist. Then you come back around and do the same thing with, they say 20 seconds. I think you should do it longer. You should do this. And the way that you remember to do that is to sing happy birthday to yourself twice. That'll get you through the whole thing. I don't think 20 seconds, frankly, is enough. I think you need to really take your time and wash up. Really wash well, like you're going into surgery. You know, you're going to do some operations. So then you get to your wrist. You don't have to go all the way up to your elbow. And then, you know, when we're ready for surgery, ready for those gloves, and you can dry your hands. So I think that's really important, is the social distancing, the washing the hands, staying indoors as much as possible. If you have symptoms, you know, if all of a sudden you start getting a fever or a cough or shortness of breath, call your doctor. It depends where you are about testing. This is very inconsistent, so I don't know exactly about the testing. Here where I am in Miami, there are some places with testing, and other places that are better testing. You know, you have to find out where you are about the testing if you get symptoms. But hopefully you won't get symptoms because you'll be self-quarantined, okay? So again, if you have any questions about that, you can go to cdc.org. As far as these drugs, I mean, I have no comment about them because they're unproven at this point in time. Right, the best way to stop this virus is to practice these recommendations about social distancing and washing your hands. Now, what we said is we're on pause. And I'd just like to end by saying that I would like you to think about, after this is over, whether it's 2 months, 3 months, 4 months, or whenever it is, what are we going to do for the reset? We're paused, we're going to reset. How are we going to go forward into the future? I think that's really important to think about as well. All right, so this is Dr. Dharma Singh Khalsa, Alzheimer's Research and Prevention Foundation, ARPF, AlzheimersPrevention.org. Here's to your health. Thank you very much.